This won't be easy. Do it anyway.
So foster parenting is not easy because it's a day in, day out endeavor. It doesn't stop. It's having a child.
My name is Dr. Paul Durbin, and this is my wife Jennifer, and we are parents of 8 children, ages 25 down to age 8. And so, yeah, we have a big family. We have a newborn, and so I know that my wife has been a saint here, waking up at all hours of the night. That's a challenge. But as we've had older foster children, they've had some challenges in terms of behaviors, and how do we cope with that? How do we deal with that? So that's created moments where we have to come together, my wife and I, to find out how best to help that child.
You want me to do it for you? Okay. You're giving everything you can give, and to do that on a day-to-day basis is a challenge.
She's very content right now. You'll learn a lot about yourself because we want things to happen our own way. We want control. And so when you have foster children, there's going to be situations you're not going to have control. That's the part that I think won't be easy, is that you have to give up yourself more than probably just about any other activity I can think of.
Sometimes they come in and they've had so many big burdens on them, and this is the very first time they've ever been able to experience childhood. So to see them play out on my trampoline in our yard, or even just enjoy a relaxed family dinner, these are experiences that are new and different for them, and that's just huge and rewarding. Like, we don't think of these things. I think we take them for granted, but it's those things that they need the most.
We have our own children that when I come home from work and I see them playing with the younger children that we have in our home, that's a great picture that I see and cherish. And just to see the foster children that we have smiling and playing and just being in a nurturing environment, that gives me a lot of joy. We really feel like this connects us and helps us to do something together as a ministry, and it's important to us and it's part of our Christian faith. Nothing's hurting in the knee?
No.
Okay. Something I noticed in the foster care training, they talk a lot about pathophysiology in the brain, like things that can happen in the brain as a result of trauma. So as a healthcare provider, I think we're equipped to really minister to children in a very unique way, as we have a good understanding about the brain. And a number of these children do have special healthcare needs, and to navigate a healthcare system that can be very overwhelming.
My training in nursing has been invaluable. I'm very comfortable navigating the medical system, taking the children in and out of doctor's appointments, and I understand medications and therapies, and I have a good grasp of why things are being done. So it makes it very easy for me to take that advice and implement whatever the professionals are saying is best for the children. So do I think everybody needs to be a healthcare professional to be a foster parent? Absolutely not. Mm-hmm. However, it is something that has been helpful because we are trained in a way to understand the human condition, how learning occurs, how development is supposed to occur, how trauma can affect those things. Also, I am constantly studying how to understand the effects of trauma better on children so that I can be a better foster mom.
As people talk to us, and I think sometimes they kind of wonder, why do you do it? It's hard. We realize there are sacrifices on our time, on our freedom to just take off. We have to just keep in mind we have a responsibility that when we care for them, you're making sacrifices. but it's worth it.
This won't be easy. Do it anyway.